Did you know that medieval women had a 1 in 3 chance of dying during their reproductive years? Ever wondered what childbirth was like without epidurals, sterile environments, or even basic antibiotics? Number 10. The aftermath: life after birth. What happened after a medieval woman survived childbirth? The dangers weren't over once the baby arrived. Postpartum care in medieval times was a mix of practical wisdom and superstitious practices that would make modern doctors cringe. Women typically spent about a month in confinement after giving birth. This period, called the lying in, allowed new mothers to rest and recover while female relatives and neighbors helped with household duties and infant care. Medieval women faced serious postpartum complications without modern medical interventions. Puerperal fever, now known as childbed fever, was a common and often fatal infection. Without understanding of germ theory, midwives and attendants could unknowingly spread bacteria from one birthing mother to another. A woman might survive the delivery only to develop a raging fever days later, with no effective treatments available. Breast infections were another dangerous complication. Mastitis could lead to painful abscesses that, without antibiotics, sometimes turned fatal. Women were encouraged to breastfeed as soon as possible, not just for the baby's nourishment, but because it helped the uterus contract and reduced bleeding. If a mother couldn't breastfeed, wet nurses were employed among wealthy families, while poorer women might use animal milk or early forms of pap, a mixture of bread, milk, and sometimes honey. The churching ceremony marked a new mother's return to society and religious life. About 40 days after giving birth, women would attend a special church service to be blessed and purified. This ritual reflected the belief that childbirth made women temporarily unclean, a notion with roots in ancient Jewish practices and early Christian traditions. Until this ceremony was performed, women were often restricted from certain activities and spaces. For medieval women, the postpartum period also included careful attention to diet. Special foods believed to restore strength and promote milk production were prepared. Hot broths, eggs, and wine mixed with herbs were commonly recommended. The humoral theory of medicine suggested that certain foods could correct imbalances caused by childbirth, restoring a woman's health and temperament. Number 9. Medieval birth control, prevention, and family planning. How did medieval women limit their pregnancies when each birth posed a significant risk? Despite the Catholic Church's prohibition of contraception, medieval people employed various methods to prevent unwanted pregnancies. Herbal remedies formed the cornerstone of medieval birth control, with plants like Queen Anne's lace, pennyroyal, and silphium being used as contraceptives. These plants contained compounds that may have had some actual contraceptive properties, though they were often unreliable and sometimes dangerous. Coitus interruptus withdrawal was perhaps the most common form of birth control, requiring no special preparations or ingredients. The rhythm method was also practiced, though medieval understanding of the fertile window was often inaccurate. Some women tracked their cycles using the phases of the moon, believing certain days were less likely to result in conception. Physical barriers weren't unheard of. Historical evidence suggests the use of makeshift cervical caps made from beeswax, linen soaked in acidic solutions, and even half lemons as primitive diaphragms. In some regions, women inserted wool soaked in various substances thought to have spermicidal properties. Prolonged breastfeeding served as a form of natural birth control for many women. Though not entirely reliable, exclusive breastfeeding can delay ovulation, providing some spacing between pregnancies. Medieval women often nursed their children for 2 to 3 years, partly for this contraceptive effect. For those desperate to end an unplanned pregnancy, abortifacient herbs were sought despite serious risks. Concoctions made from herbs like mugwort, rue, and savin were used to induce miscarriage, though these often caused severe hemorrhaging or poisoning. The line between contraception and abortion was blurry in medieval understanding, with many remedies being prescribed to bring on menses or remove obstructions, euphemisms that could refer to either preventing conception or terminating early pregnancy. Number 8. Childbirth complications, when things went wrong. What happened when a birth didn't progress normally? Medieval midwives faced numerous complications with limited tools to address them. Obstructed labor, where the baby couldn't pass through the birth canal, was particularly dreaded. Without cesarean section as a safe option, prolonged labor often resulted in the death of both mother and child. In some desperate cases, embryotomy, the dismemberment of the fetus to remove it piece by piece, was performed to save the mother's life when the baby was already dead or death was certain. Breech presentations, when the baby comes feet or buttocks first, were especially dangerous. While experienced midwives could sometimes turn a baby externally or deliver in the breech position, many women and babies died during these complicated deliveries. Midwives used various techniques to encourage babies to turn, including positioning the mother in different ways or applying pressure to her abdomen. Hemorrhage posed another deadly risk. Postpartum bleeding could quickly become life-threatening without modern interventions. Midwives used herbal remedies like shepherd's purse or birthwort, which contain compounds that can constrict blood vessels. Direct pressure, cold compresses, and elevating the mother's hips were also practiced. In severe cases, the midwife might actually reach into the uterus to remove retained placenta pieces or massage the uterus to encourage contraction. Eclampsia, now recognized as a severe complication of preeclampsia characterized by seizures, was described in medieval texts as the falling sickness of pregnant women. Without understanding its cause or effective treatments, midwives could only observe for warning signs like swelling, headaches, and vision changes, then attempt to manage the seizures if they occurred. Some medical texts recommended bloodletting for this condition, which may have temporarily reduced blood pressure but could worsen anemia and overall health. For women who survived complicated deliveries, childbirth injuries could cause lifelong suffering. Obstetric fistulas, abnormal openings between the birth canal and bladder or rectum, left women incontinent and often socially isolated. Prolapse, where pelvic organs descend into or outside the vagina, was another common result of difficult births. Without surgical repair options, women used pessaries made of materials like wax, wood, or metal to hold organs in place. Number 7. The birth chamber, setting the scene. Who was allowed in the medieval birth room? The birthing chamber was a strictly female space where men, even physicians, were typically excluded unless a life-threatening emergency arose. Birth was considered women's work, handled by a midwife and several female relatives or neighbors who acted as birth attendants. These women provided physical and emotional support through what could be a long and arduous labor. The physical environment was carefully prepared according to local customs and medical theories. Windows might be covered to prevent drafts, as medieval medicine feared cold entering the body during labor. Conversely, the room was sometimes kept too warm by modern standards, with fires burning regardless of season. This reflected the humoral theory that warmth helped the mother's body open for birth. Birthing furniture varied by region and class. Wealthy women might labor in bed, while poorer women used birthing stools or chairs with a cutout seat that allowed gravity to assist the delivery. Some women gave birth kneeling, squatting, or standing while supported by assistants. In many regions, straw was spread on the floor to absorb fluids, even in noble households. The atmosphere combined the practical with the spiritual. Religious items like holy relics, blessed candles, or amulets inscribed with prayers were placed around the room for divine protection. The belt of Saint Margaret, patron saint of childbirth, was particularly sought after, with replicas being placed around the laboring woman's waist to ensure a safe delivery. Birth girdles made of parchment inscribed with prayers and charms were another common protective item. Noise levels in the birth chamber varied according to cultural beliefs. Some traditions encouraged quiet to avoid disturbing the laboring woman, while others involved loud encouragement, singing, or even shouting to help the mother push. The sense of the birthing room would have been strong, with herbal preparations, burning incense believed to ward off infection, and the inevitable bodily fluids of childbirth creating a pungent atmosphere. Number 6. Tools of the trade, medieval midwifery equipment. What tools did a medieval midwife carry in her bag? Unlike today's high-tech delivery rooms, medieval midwives relied on simple and often multi-purpose tools. The midwife's hands were her most important instruments, trained through apprenticeship to feel the baby's position through the mother's abdomen and to assist during delivery. Most carried knives or scissors to cut the umbilical cord, though these tools weren't always as clean or sharp as modern standards would require. For difficult deliveries, some midwives possessed more specialized equipment. Birthing hooks and crochets, grim metal instruments designed to extract a dead fetus, were used as a last resort to save the mother's life. These tools resembled large crochet hooks or had blunt or sharp ends depending on their specific purpose. A speculum-like instrument called a dilator appears in some medieval medical texts, used to examine or widen the birth canal in complicated cases. Herbal preparations formed an essential part of the midwife's toolkit. Ergot, derived from a fungus that grows on rye, was used to strengthen contractions and reduce postpartum bleeding, though its use was dangerous without precise dosing. Oil of roses or other slippery substances served as lubricants during examination or difficult deliveries. Herbs like chamomile and lavender were brewed into teas to calm anxious mothers. Pain management relied heavily on herbal remedies. Willow bark containing salicylic acid, similar to aspirin, might be chewed or brewed into tea. Opium poppy preparations were sometimes used for severe pain, particularly during complicated deliveries. Wine or ale served both as disinfectant and pain reliever, with some regions producing special groaning beer specifically for labor. String or thread for tying off the umbilical cord was always in the midwife's kit, often made of linen or silk for wealthy families. Swaddling bands, long strips of cloth used to wrap the newborn tightly, were prepared ahead of time. These weren't just for warmth but reflected the belief that swaddling helped a baby's limbs grow straight and strong. Number 5. Saints and superstitions, spiritual protection in childbirth. Who did medieval women pray to during labor? Saint Margaret of Antioch emerged as the primary patron saint of childbirth in medieval Europe. According to legend, Margaret was swallowed by a dragon but burst forth from its belly unharmed, a narrative that paralleled successful childbirth. Pregnant women kept her image nearby or read accounts of her life during labor. Some women even placed written copies of her life story directly on their abdomens during difficult deliveries. Amulets and talismans provided another layer of spiritual protection. Eagle stones, edites, hollow geodes containing loose material that rattled when shaken were especially prized. These stones were tied to the thigh during pregnancy to prevent miscarriage, then moved to the upper body during labor to draw the baby downward. Gemstones like jasper were believed to speed delivery, while coral protected against evil influences. Written charms combined Christian and pre-Christian elements. Parchment inscribed with prayers, biblical passages, or magical symbols was placed on the laboring woman's body. Some charms contained seemingly nonsensical letter combinations that held symbolic meaning or represented abbreviated prayers. The SATOR square, a palindromic word puzzle with Christian associations, appeared frequently on birth amulets. Rituals involving household items served practical and spiritual purposes. Unlocking all doors and chests in the house symbolically opened the birth passage. Keys placed in the mother's hand or under her pillow were thought to unlock a difficult labor. Knots in the room were untied to prevent the umbilical cord from tangling, and women unbraided their hair to remove any symbolic bindings that might impede birth. Religious relics provided the highest level of spiritual intervention. Churches often owned birthing relics that could be borrowed by women in labor, though usually for a fee. The belt of Saint Margaret was particularly sought after, with many churches claiming to possess the original. These sacred objects created a tangible connection to divine protection during the dangerous transition of birth. Number 4. Herbal remedies, medieval medicine for mothers. What plants helped ease medieval labor pains? Midwives maintained extensive knowledge of herbs for each stage of pregnancy and childbirth. During pregnancy, herbs like raspberry leaf were consumed as tea to strengthen the uterus and prepare for labor. Wild yam and black cohosh were used to treat morning sickness and various pregnancy discomforts. Many of these preparations were accompanied by specific rituals for gathering and preparation that combined practical preservation methods with spiritual significance. To induce labor when a pregnancy went beyond term or when a mother was in danger, midwives turned to herbs with oxytocic properties. Blue cohosh, which contains compounds that stimulate uterine contractions, was commonly employed. Angelica and juniper were also used to bring on the courses, a phrase that could refer to either menstruation or labor. These powerful herbs were administered gradually, with midwives watching carefully for signs of excessive contractions that could harm mother or baby. During labor, pain-relieving herbs included poppy preparations, which contain opiate compounds, though these were used sparingly due to their effects on the baby. More commonly, women laboring in pain might be given chamomile, valerian root, or catnip, which have mild sedative properties. Willow bark containing natural salicylates similar to modern aspirin was another option for pain management. For the delivery itself, herbs with antiseptic properties were applied to the birth canal or used to clean the midwife's hands. Lavender, thyme, and sage all contain natural compounds that inhibit bacterial growth. These same herbs might be burned in the birthing room to purify the air, an intuitive practice that predated understanding of germ theory but may have had some protective benefit. After birth, herbs played a crucial role in preventing and treating complications. Shepherd's purse and lady's mantle were administered to reduce hemorrhage due to their astringent properties. Comfrey was applied to tears and wounds to speed healing, while calendula ointment prevented infection. Fennel, blessed thistle, and fenugreek were given to new mothers to increase milk production, practices that continue in some traditional medicine systems today. Number 3, the midwife. Medieval birth attendants, who delivered babies in medieval times. Midwives occupied a unique and somewhat precarious social position in medieval society. These women gained their knowledge through apprenticeship rather than formal education, training under experienced practitioners for years before practicing independently. Most communities had at least one midwife, and she typically assisted with all local births regardless of social status, though wealthy families in large towns might have access to midwives with elite clientele. The medieval midwife's role extended far beyond the birthing room. They advised women on fertility, pregnancy concerns, and infant care. They served as expert witnesses in cases involving pregnancy, virginity, or suspected infanticide. Some midwives also performed emergency baptisms when newborns seemed unlikely to survive long enough for a priest to arrive, highlighting their position at the intersection of medical and spiritual authority. Legal records reveal both the respect accorded to skilled midwives and their vulnerability to accusations when births ended tragically. Municipal records from large towns sometimes show midwives receiving payments from town councils for attending poor women, indicating official recognition of their essential role. However, when maternal or infant deaths occurred, midwives could face accusations of incompetence or even witchcraft, particularly during the witch-hunting periods of the later Middle Ages. The tension between female midwives and male physicians grew throughout the medieval period. University-trained physicians, exclusively male, considered childbirth beneath their dignity, yet increasingly attempted to regulate midwifery practice. By the late medieval period, some regions required midwives to be licensed by physicians or ecclesiastical authorities, despite these men having little practical knowledge of birth. This marked the beginning of a centuries-long struggle for control over childbirth knowledge. The tools and techniques of medieval midwives blended practical experience with the medical theories of their time. While physicians wrote Latin treatises based on ancient authorities, midwives passed down hands-on skills for determining fetal position, managing complications, and supporting women through labor. Their approach often proved more effective than theoretical medicine, particularly in normal births where intervention could cause more harm than good. Number 2. Childbirth across classes, from peasant hut to royal chamber. Did queens give birth differently than peasants? While the biological process remained the same, the childbirth experience varied dramatically across social classes. Royal and noble births were elaborate affairs with significant political implications. A queen's labor could determine a dynasty's future, so her birthing chamber was carefully prepared, sometimes weeks in advance. Special tapestries depicting positive birth outcomes might be hung, and expensive imported spices burned as incense. For royal women, privacy during birth was actually more limited than for commoners. Important witnesses needed to observe the birth to verify the legitimacy of an heir, especially for royal deliveries. Ladies-in-waiting, midwives, and sometimes political representatives would crowd the chamber, making the experience of royal birth surprisingly public despite the private setting. The birthing room of Eleanor of Castile, Queen of England in the late 13th century, reportedly held so many people that the floor collapsed during one of her deliveries. Urban middle-class women experienced childbirth with more comfort than peasants but less ceremony than nobility. A merchant's wife might give birth in a dedicated chamber with a proper bed, attended by a paid midwife and female relatives. Guild records show that craftsmen's wives often received gifts of food and drink from their husbands' colleagues to sustain them during labor and recovery, creating a community support network. For peasant women, childbirth often occurred with minimal pause in their daily responsibilities. Agricultural duties couldn't wait, so women sometimes labored in fields or returned to work shortly after delivery. Their birthing environments were simpler, perhaps a straw-filled mattress in a one-room cottage with family members present. The same midwife might serve an entire village, sometimes traveling considerable distances when called. The most destitute women faced truly desperate circumstances. Homeless women or those in extreme poverty sometimes gave birth in streets, doorways, or charity hospitals with minimal assistance. Municipal records occasionally mention foundlings discovered with umbilical cords inexpertly cut, suggesting births that occurred without any skilled help at all. For these women, the physical risks of childbirth were compounded by exposure, malnutrition, and lack of postpartum rest. Number 1. The dangers: maternal and infant mortality. How dangerous was it to give birth in medieval times? The statistics paint a grim picture. Researchers estimate that maternal mortality rates ranged from 1 to 5% per birth, with the cumulative risk over a woman's reproductive lifetime reaching as high as 12% in some regions. Given that a medieval woman might experience 5 to 8 pregnancies during her life, these odds meant that childbirth represented one of the most significant threats to adult women's survival. Infection claimed countless mothers' lives. Without understanding of germ theory, even well-intentioned birth attendants could introduce deadly bacteria during internal examinations. Puerperal fever, an infection of the reproductive tract following childbirth, could progress from initial symptoms to death within days. The fever, chills, and abdominal pain of this infection appear repeatedly in medieval accounts of maternal deaths. Hemorrhage represented another leading cause of maternal mortality. A woman could lose her life to bleeding in minutes if the placenta detached improperly or the uterus failed to contract after delivery. Medieval midwives recognized this danger and employed various techniques to address it, including uterine massage, herbal remedies with oxytocic properties, and application of cold compresses. However, without blood transfusions or surgical interventions, severe hemorrhage remained largely untreatable. Obstructed labor, where the baby couldn't pass through the birth canal, created agonizing dilemmas. Without safe cesarean delivery, both mother and baby often died after days of fruitless labor. Occasionally, surgeons might attempt to save the mother by dismembering and removing a deceased fetus, but these procedures carried extreme risk of infection and injury. Women who had experienced childhood rickets due to vitamin D deficiency faced particularly high risks of obstructed labor due to pelvic deformities. For those babies who survived delivery, the dangers had only begun. Infant mortality rates approached 30% in the first year of life during the medieval period. Premature babies had almost no chance of survival. Even full-term infants faced threats from poor feeding practices, contaminated water used to dilute animal milk, and infectious diseases that spread rapidly in crowded living conditions. The emotional impact of these frequent losses is rarely captured in historical records, but must have been profound for medieval families. Would you have risked pregnancy knowing these dangers, or chosen to avoid it at all costs? How might medieval women have felt knowing each pregnancy could be their last?